All right. Wow.
Hello, everybody, and welcome to week 6 of our regional report out calls. This is January 19th in the Kansas City Metro. We'll be here every Tuesday at 1 o'clock on this YouTube channel, recording live. I want to encourage you, if you haven't already, sign up for the email where you get the dashboard that we discuss, anything else that's important to send on, and a link to this video. You can go to covid.ks.gov/report-outs. That's covid.ks.gov /report-outs. And then if you have questions or comments, you go to ksregionalreport@gmail.com. Send us an email and we'll try and make sure we address it on this call if we can. Okay, so let's start. Our normal cadence will be to look at the dashboard here and then to hear from public health and hospitals. And then we have a special guest that's going to talk to us about testing. And we have Dr. Watson back with us to talk about transfers. And well, a lot to look forward to here today in there. Okay, let me share my screen. Pull up the Kansas City Metro here. All right. Hospitals expecting some staffing. This is much better than where we were, still a little high. I think this is among the highest in the state, what we're seeing in the KC Metro, but I was on a call with some hospitals earlier. They do believe this number is getting better. We like to look at this because hospitals have issues at staffing, space, or stuff generally, and staffing's been the pinch point lately. And then we come through, and I have some stats just comparing last week, this week. It's almost all good news. So last week in the Kansas City metro area, we had 863 hospitalized, confirmed, or suspected COVID patients. This week, we're at 684. We dropped from 184 ICU beds with suspected COVID patients in them down to 163. And then coming over here to adult staffed ICU beds that are available, we went from 121 last week to 143. This is the number you want to see go up. Obviously, this is the open and available beds, which has moved us from 20% to 25%. So this is probably the best. I'd have to go back and look, but the best or close to the best in the 6 weeks we've been doing this. Just also in good news, we're not seeing, we didn't know when we were seeing this last week when we'd gone from 3,000 to 3,500 to 4,200 if we were about to see this thing continue to slope up, but we did come back in the last week to 3,400. So we still want to see that bend back down, but at least it's not bending up, and this is the number of new cases this week. And then, on our dashboard, second page, this is percentage of the population, each of these counties that has tested positive. And of course, our ICU bed census here between COVID and non-COVID and what's open. So generally good news, the best report, like I said, that we've looked at here, and generally pretty positive across the state as well. I'm going to show one thing here. So we talked about vaccines last week. And I just want to make sure that, if you go to, let me make sure it says kansasvaccine.gov, and go to vaccine data here on the top. So that's kansasvaccine.gov and vaccine data. You can see where we're at as a state. Now this lags a little bit as things go out, but we've got 101,000 people that have gotten their first dose, and we're well on our way to getting that group on their second. So 3.5% of the state, 200,000 distributed. We believe this number is actually much higher, like we said, but you can see the split in the Moderna versus Pfizer, and then how this is going. So this will be something I know people are going to want to watch as things move on. So that's again at kansasvaccine.gov and vaccine data. I also just thought I'd show this. So, I tell you about where to go put in your email, again, past dashboards and all that, but really easy to put in your email address and which of these you want to sign up for. And then you can always come back here and get down here. We have all the archived from the last 6 weeks of these calls. So there's that. Just thought I'd show all that while I had my screen up. And now let's come back to this wonderful group of people we have on this call. And I'm going to kick it over to our friend Steve Mayhew in public health. Steve?
All right, thank you. I'm Steve Mayhew with the Johnson County Department of Health and Environment, giving the public health perspective on the KC Metro's COVID response. As John pointed out, the numbers seem to be trending in the right direction. We certainly hope it continues that way. It's good to see that case numbers are coming down, positivity is coming down a little bit. Not enough to say that it's a downward trend at this point, but it certainly is, as John mentioned, better than heading up. And so encouraging to see that. We obviously continue to test. And I know we have a presenter here from KDHE who's going to talk a little bit about testing throughout the state. So I'll just touch a little bit. We're still focused primarily on trying to get as much vaccine out the door as we can. To date, the health departments and hospitals within the KC Metro have received and given vaccine. John pointed out a great resource to see sort of how vaccine is getting distributed throughout the state. One thing I will mention, as John alluded to, was sometimes there's a little bit of a lag. And so it looks like, 101,000 doses out of the 202,000 have been administered. That number is actually a little bit higher. It just takes time to process the paperwork and get that uploaded into the system. And so I know for our health department, we try to hang on to vaccine for as short a time as possible to make sure we get it out there. And so we're still working on the phase 1 population, but hope to be moving into our phase 2 groups soon within the next week or so. That decision, and I'll just highlight, that decision is usually, we're awaiting guidance from KDHE on when to move into phase 2 as a region. And so once the state gives us the go ahead, all counties in the metro area should be on that same page. I really don't have much to update today. It's pretty much the same as last week. I don't know, John, if you've received any questions but I want to give some time to the other presenters as well. So
no, Steve, that's great. And that's a good report out, and appreciate all that you guys are doing. Let me kick it over to Kenny.
Yeah, so Bryant, this is Kenny Welk with the University of Kansas Health System. And Bryant, I'll go ahead and make a comment or two, then see if you want to add any color commentary. But I would just echo the sentiments.
Oh, we lost Kenny there. Everybody else still with us?
Oh, this morning. And I would categorize ourselves as cautiously optimistic. The numbers are going in the right direction. We are grateful for that. We're 4 weeks out now from Christmas. So typically that's a real benchmark time. And the fact that the numbers have stayed stable or even dropped a bit is good. Next week, we'll be 4 weeks out from New Year's. And it looks like we're going to continue to get through that. So we are grateful for that. We are certainly hoping that with all the efforts and a big shout out to all the people that put in so much time, energy, and effort in driving messages out across our state to practice the infection prevention protocols. And we know what a sacrifice that has been, but it sure looks like, John, that it's working. Our staffing situation and the staffing situation in most of the hospitals in the metro this morning also has been confirmed is getting better. Now that's a combination. We think that certainly the fact that we're getting more people vaccinated, that's beginning to play out now. We'll move into many of our first people that got shots are now getting their second shots. So over the next 2 to 3 weeks, we expect a lot of that. And then that once we get everybody that second vaccination, and that should make a real difference. So again, we're cautiously optimistic, but we all need to stay diligent and continue to do the things that we're doing to get through this. We still have a ways to go.
Thank you,
Bryant.
Well, Kenny, thank you so much. This is Bryant McNally with the Kansas City Metropolitan Healthcare Council. And, I just really want to echo a lot of what Kenny said. We're looking at 4 weeks out, and, we've always known that hospitalizations lag. They're a lagging indicator. We know that there weren't as many positive test results during those couple of weeks around the holidays. And we attributed that to people just choosing not to get, testing being down a little bit. While that may have been true, we are seeing the fact that those lower numbers are playing out in lower hospitalizations. So maybe there was a little bit more to it than just lower testing throughout that time period. So that's something that's really hopeful. And I think, just double down on what Kenny was talking about, staffing. Staffing is getting better, but it's still going to remain a concern for the foreseeable future, especially if you begin to think about the schools getting back in session now and some of those things where, it puts some of those juggling demands on parents and households to manage that depending on how it's based. And that just creates a little more stress and pressure on the staffing situation. But we have seen that work really starting to play out a little bit better. And then really the final thought is just, vaccines. The states have different approaches across the metro area. So it's going to be confusing to the general public as it rolls out. And that's unfortunate. But the simple fact of the matter is if you're eligible wherever you live, step forward and, get that vaccine while it's available. And, the supplies will continue to ramp up over time. And I think that's, just one of the things that we've seen some of those healthcare workers that wanted to wait a little bit now are seeing, positive results in their peers and are beginning to get back in line to get vaccinated. So I'll just kind of stop with that right there, John, and turn it back over to you.
All right, thanks. And best looking chair of any presenter today. So you got that going for you too. Okay. Hey, I'm going to kick it to Dr. Watson. Dr. Watson, you want me to make it so you can share your screen?
Yeah, if you would, that's great.
Yeah.
I think we've got.
And if you want to just talk about what you're seeing on the transfer situation in the hospitals.
Yeah, I think everybody is thankful that it looks the way it does. This is the current board that we're looking at. And if everybody can relate to previously how much red is typically on this board, and now we're seeing a lot of yellow and some green. So it is easing, and I think that's reflected statewide in the wait times related to COVID patients. For the most part, we are running on average about an hour and a half, hour 40, but reality is COVID is under 2 hours now, and we're right around an hour 5 for non-COVID patients. So the numbers are easing a little bit. The hospitals are opening up statewide, and we're seeing that wait times are falling back toward what we would consider more realistic timeframes. The numbers aren't changing much. We're still running 30% COVID patients on the transfers, and about 35 to 40% statewide of the requests we get are for bed placement. So we know there is still a need, and that's continuing.
Good news. Thank you, Dr. Watson. We appreciate that from Cheyenne Mountain Software, which is the mission control application and software that's helping move patients around as they need to around the state. So, and then, I think you kicked it to Megan. Megan, can you kick it to our new special guest? So let me introduce everybody to Dr. Joan Duvey. Her friends call her Groovy Duvey. Is that right? Or am I just calling you Groovy Duvey? We're glad to have you here. You're muted. You'll want to unmute yourself. But Dr. Duvey is working with KDHE and helping with the testing. And so we're looking at our testing strategy and where that's going. And she's going to give us an update there of that. So
thank you. Thank you very much, John. And it's really a pleasure to be here with you today. And while I'm figuring out, sharing my screen, I do want to say that we have achieved a couple of milestones. First milestone is that we have, since the beginning of the pandemic, tested more than 2 million Kansans, more than 2 million tests, and that is more than 1 million Kansans. So we are seeing increases in the number of tests that are done and the number of people who are getting tested, which is really great news. All right, so today, John asked me to talk a little bit about what role does testing play in the response? Where can I find a testing site? How is the testing strategy evolving? And where do we need engagement from folks in the regions? So let me just start by saying that testing continues to be a critical tool that we are using to manage impacts of the pandemic. So we're all aware that we need testing to identify people who are positive, given especially the 50% asymptomatic positivity It's really important to identify people who are positive so that we can get them isolated and hopefully reduce the spread to their family, their friends, other loved ones in the community. Protecting at-risk populations, as we know, the nursing home staff, for example, staff at correctional facilities, healthcare providers, getting these folks tested and vaccinated will help protect those that they care for at their facilities. And then also, identifying people who do have COVID so that if they are symptomatic, they can get treated for their symptoms, whether that's outpatient treatment or treatment in the hospital. And then testing is really vital for economic recovery as well, helping folks to feel more confident about returning to work and school, trying to keep people as safe as possible and reduce ongoing transmission. And then restoring confidence for all of us when we do what we need to do on a daily basis to get our groceries and take care of our families. So one of the questions we hear periodically is, well, gosh, now that everybody's getting vaccinated, why do we still need to continue testing? We know that testing will continue to be important, as important as it is today, even as we increase the numbers of people who are vaccinated, because we will need to use testing to continue to identify where that virus is so that we can isolate people who are infected and hopefully stamp out the ongoing transmission as we're building that herd immunity in the population. So we will continue to push forward with testing and encourage everyone in Kansas to get tested. Oh, there we go. And so where can you get tested? This is a map that shows all the testing sites that we currently have online. The green ones are mass testing sites run by some testing partners like Well Health and NIC USA. There are community testing partner sites, and these are sites that where we have community members, whether FQHCs, for example, or hospital systems who are helping with testing. And then health department testing sites are in the yellow. And then we do have some mobile testing units as well. So we are continuously looking at the map. You can see some gaps there. And we really have this vision of having some testing sites and probably smaller testing sites in those more rural communities, but testing sites up and running in every single county. And we are focusing a lot now on community testing partners that may be trusted partners in the community, where people will feel comfortable in getting a test taken, where they might not at a big mass testing site. And so we are working to always improve the testing experience. We want to improve access, as I just spoke about, by partnering with local organizations. We're working on expanded support for community testing. We have a menu of options that we've developed for local health departments to help meet the different needs of every community. We are beginning engagement with local organizations, including Methodist churches and other faith-based organizations. And the Kansas Department of Health Lab is working on bringing online mobile testing units to allow more agile deployment in response to outbreaks or requests in communities. And then we have a pilot program with 3 local health departments now, where they are receiving mail-in saliva kits that consumers can actually complete in their own homes and then mail directly back to the lab. So the local health departments will have these, and we'll be able to distribute them. We'll be able to use them for other testing events if they would like. And so we'll see how that goes and hopefully be able to expand that more broadly. We are also working on improving the patient experience. We've been spending a lot of time working with our end-to-end testing partners on improving turnaround time. So we have now begun integrating the specimens collected by these vendors with local Kansas labs. And by doing that, we're reducing the transport time. So already we're ahead of the game with turnaround time. And we're very, very pleased with the outcomes of this integration. And we'll expand this. We'll look to expand this across the state. We are working on responsiveness to issues that we hear about, and also working on distributing antigen tests to support surveillance testing, and doing that with our community testing partners in schools. And then the mobile unit we talked about, again, surveillance testing or engaging with at-risk communities based on methods of surveillance like wastewater sampling, and really just to make sure that we have an opportunity to expand our testing footprint in those rural communities across Kansas. So local is key here. Really engaging with local partners in the community will help. We want to work with you to drive testing in your county or your region. We really look to you for to feed back information to us about what is going on in your community. How are the testing events working? How can we improve those? And we really need our local partners to get the word out, let people know about testing, let them know how important it is, especially as we go into this last phase, hopefully, of managing this pandemic with vaccination, and just really continue to encourage testing and vaccination in your communities.
And Dr. Duvey, when you are asking for that feedback, what's the best way for people to get a hold of your group?
That's a very good question. So typically through the local health department, or calling the Kansas Department of Health and Environment. I think there's a call number, and I don't know that off the top of my head. Okay. Also, I mean, honestly, I'm happy to take that feedback, and you can email me at and I can put it. John, should I just give that to you and you can get that out to people? It's joan.duvey@ks.gov.
Yeah, if they email us at ksregionalreport@gmail.com, we can get them that email if you want to put yours out there. I know in Kansas City they're pretty well covered, I'd guess, with testing and things like that. But as we get into the more of the regional report out for the rest of the state that have more rural pockets in them, I bet that's where you'll start to find those questions. So you can think between now and then how you best want to do that too. So.
Yeah,
any questions for Dr. Duvey or any comments on anything that we've heard so far? I heard Dr. Norm, I think, say this morning too, we're starting to, I don't know the right way to say this, starting to break apart the genome effort of this so that we can keep an eye out for that more contagious variant. I think we're starting to ramp up our efforts to make sure we're looking at more of the samples that are coming in across the state. Do you know anything about that?
I do. The lab is now really ramping up its genetic sequencing of the virus.
That's what it's called, yeah.
Yeah, to help identify the England variant, or any variant actually that shows up. So I think that we're also sending samples to the CDC, and they're doing some genetic sequencing as well. And then I think there are some kinds of PCR tests that are run where they look for different target areas, and if there is a lack of that target area, then that may indicate that we have one of the variants, and then they can do some sequencing on that sample. And again, looking at surveillance, if there are communities that seem to be outliers in terms of how rapid people are transmitting from one to another, then certainly that particular area would be targeted for additional testing.
That's great. Well, I mean, and everybody, I love your comments on this. Just, as we're seeing better numbers, certainly not out of the woods yet, but as far as some of the concerns we had coming out of the holidays, I think we all would have taken what we're seeing right now based on where we were in December and early January. So it seems to me that the state is in a race between getting that vaccine out and reaching that herd immunity, and before that more contagious variant creeps across our borders and starts to become the dominant variant in Kansas, as we've seen in some other states. Would you agree with that?
Yeah, I think we can assume that the variant is here in some way, shape, or form. And I think that exactly what you said, we need to just keep testing and keep getting people access to vaccine as we get the vaccine shipped to us from the federal government, and just get those shots in arms as quickly as we can. Mm-hmm.
Perfect. Well, before I wrap it up, Kenny, Bryant, Steve, Dr. Watson, anything you'd like to add?
Nothing from my end. No, sounds
We
good.
covered it all. Okay. Well, we're going to keep these calls going, and we'll be here next week at this time. I got a bright spot, so we like to end these calls by catching people doing something right. And I didn't have anything from Kansas City particularly, though Kansas City was mentioned in the story. Did any of you guys have a Kansas City Metro specific bright spot you want to share? Anybody? Okay. Besides you guys being a bright spot. So a group out of Wichita, start with I saw this on KSN down here. Amy Sharash, should make sure I said her name right. Amy Sharash and Amber Tracy have put together meals for COVID wings and nurses and groups like that. Started in Wichita, has gone all the way up to Overland Park. And they're quoted in the stories. They keep telling us thank you, and we're like, no, all thanks goes to you. You're the ones doing this. You're the ones saving families, saving lives, and putting your lives at risk to do these things. I love their spirit. And they have a GoFundMe page, Feed the Healthcare Heroes. If you go there, and they're trying to branch out into any market and support some of the local restaurants by getting that food, but they do snack foods and all that stuff. So I just love seeing two people. Started with Amy's parents being in the COVID wing at St. Francis, and she wanted to take care of them, fed them, put it on Facebook, and then Amber heard about it, and it just went from there. So I just love seeing Kansas step in, care for people that need it the most right now. Anyway, so there's a bright spot. Thank you guys. Hopefully we'll continue to see these trends. Don't let up. We got to get more people vaccinated, and we'll hopefully have more vaccine news next week on this call. So please go to covid.ks.gov/report-out, sign up for the email and then with the dashboard and these calls, and we'll go from there. Thank you, everybody, for your time today and all the work that you're doing. I hope you have a great week, and we'll see you next week.